This is like dealing with COVID, but spread out over 20 years.
Hello and welcome to another episode of Red Dot Hot Takes. My name is Hossan Leong and a very warm welcome to our guests today. First up, we have Dr. Jade Kwa. Now, she's the founder of Jade Life and Wellness as a life coach, also a pediatric emergency medicine specialist and adjunct assistant professor at NUS and Duke NUS medical schools. So Jade, what is your passion?
I think it'd be accurate to say that wellness is my passion. So on the physical piece, I'm a senior consultant at the emergency department in public hospitals. My portfolio is emergency medicine for pediatrics as well as trauma. But I also feel like other than physical wellness, there's also a mental and emotional component in everybody that's super important as well. And that's why I set up my life coaching company, where I focus on clients who are not sick, not broken. They just want to reach their goal.
That's like a very holistic approach as well to wellness, right?
Thank you.
Yeah. All right. Thank you for being with us today. And up next, we have Yinzhou, the Director of Citizens Adventure. And also you founded Geylang and Dakota Adventures, Back Alley Bubbers, and several other initiatives for social good, as well as Assistant Manager in an elder... Wow. Do you have time for yourself?
Yeah, so I tell people I have 3 jobs today. So in the day, I work in a elder care center, running active aging centers island-wide. In the night, I do tours and on weekends as well, around social issues. And that's where my heart is, social issues that would also make or break the future of Singapore. So my 3rd job is I'm a new father. So I have a young 15-month-old baby. Yeah, so it's really a handful. I juggle. Yeah, I don't manage, I juggle.
Well, I think you managed to juggle. That's good.
Yeah, for now. Yeah.
And we also have with us our Minister for Health, Minister Ong Ye Kung. Thanks for being with us. Now, obviously,
my title is the shortest.
The shortest.
Yeah.
Well, Minister is quite heavy. You are here because we are tackling one of the pillars of the ForwardSG exercise. Now, just to remind everyone out there as well, do you all know what the 6 pillars are?
I know care is one of them.
Care, which is what we're going to do today. Yinzhou, we have build, we have equip, we have unite, very important, empower, and of course, we have to steward this country as well in the right direction. So let's kick things off, ladies and gentlemen, and we're going to discuss today, are we in the pink of health or are we having the blues? So Min Ong, maybe you can start us off. What is the government doing under the care pillar in this ForwardSG exercise?
Care pillar. So that's broader than health. I like to look at where we are now, where we will be 10 years from now, and what will be the major changes. Some things are evergreen, right? You must always take care of the poor, and you must always give social assistance. You must help the disabled, so on and so forth. These are evergreen. We always have to do those. But in the next 10 years, some major things may change. And I think one major thing is aging. And there's a huge social transformation. In the history of Singapore's independence, we have not seen that happen yet. This is the first time. So we will experience it for the first time, what it means to be an older society. Second will be, as our economy grows, some people are going to do very well. Some people will not be able to seize the opportunities. And so there will be wider inequality. So that I see as the second major change in the next 10 years. Aging and inequality. And so the care pillar is about how do we address the concerns arising from these major changes.
So let's talk about a little bit about the health part of the care pillar. We have heard this term healthier SG that's being bandied around everywhere. What does that mean?
I say we are aging.
Yeah.
Right? You cannot reverse aging, but it does not mean that we must be less and less healthy. Right?
Right.
And if you look at the trends today, Singapore is not in the pink of health. Yeah. If you look at our annual survey of disease incidence, it's getting worse, no? The sun cow, right? So the incidence rate is getting higher and higher.
Yeah.
Yeah, but there are things that we can do to prevent it or even reverse it.
For sure.
And to manage it. Yeah. So therefore, we come out with this national movement and national program. We came out with the name healthier SG, there's meaning behind it. Because I don't think we are healthy enough, and therefore we need to be healthier. And since we are Singapore, so healthier SG.
So in a way, it's more, we're trying to get into the mindset of preventive rather than having to treat it. So in your experience, Jade, wellness, getting us ready for the future in terms of health, what are your thoughts on that?
Well, if I put my coaching hat on, and with the lens of what I see in public healthcare, I think what it is that we need to be accountable for our own health. That's the first thing. So having that awareness of where we are at individually as a system is very helpful. And then asking ourselves, what do you want to do about it? Right? So Minister has just said that we're all going to be aging. What kind of an aging population would we like to be? You want to be a healthier aging population, right? So how do we do that? So raising, I think, the medical literacy amongst people in Singapore, getting the support, right, and their resources around them, not just in the A&E when things go terribly wrong, but in the community as well, making use of primary healthcare, making use of your family to support you, to understand what's happening, having resources to be able to age in place, right? To age at home.
Can I ask questions? Yes. I always ask doctors questions. First, you mentioned primary healthcare. What is primary healthcare?
Right. So primary healthcare might be, for example, for the chronic illnesses, say high blood pressure, high sugar, and high cholesterol, right? The three big highs. Those would be very helpful for chronic disease management. But your GPs, your family doctors are very, very helpful for you to approach when, to follow you through, right? From cradle to grave, so to speak. So that can be quite helpful too. We also have entities like the urgent care center that are coming up now. So that's something that's in between a GP and, say, an emergency ward. So you don't necessarily have to go to the emergency department all of the time for something that's bothering you. So I think also raising the health literacy of Singaporeans so that we understand where's the right place to go when you need help is super important.
So in other words, actually in healthcare, there are many layers. Primary healthcare is the most basic layer, that everyone should have. Not very different from when we go through education, other than preschool, we go to primary school. Without primary school, you can't take your PSLE and you can't go to secondary school. The problem with us is that many of us ignore primary health care. So actually, when we talk about healthier SG and preventative care, it's really about strengthening primary care.
Right.
To take care of the health of people.
Well, you know what? We're going to go straight into our hot take right now. Hot take one, and this is aging is a silver tsunami, and we'll just have to live with the consequences as a society. Now, up to 25% of our population is going to be over 65 by 2030. So, Min Ong, let me ask you, what can we look forward to in terms of this older aging cohort? I mean, what is the government putting in place?
Can I just comment on the hot take?
Yeah.
We just have to live with the consequences or as a society. I agree and disagree with this statement. I think it depends on what consequences we are talking about. If we are saying that the consequences is our demographic, by age will change, you have to live with it. It's a fact, right? People will age.
Yeah, burdening the healthcare system.
If that is the consequence, then I refuse to accept it.
Okay.
That I refuse to accept that just because all of us go up by 1 year every year and demographically our pyramid shifts, and therefore we must burden ourselves with a huge disease incidence, and that our healthcare expenditure as a nation is just going to shoot through the roof. I think we cannot accept it. I think old people do fall sick more often. You and I experience that, but it need not be at such high incidence. We can do something about it if we take action early enough. We can prevent, manage, even reverse such diseases.
Managing it with, exercise and of course with medication, and it's being kept under control. So is my cholesterol. But exactly. So being able to detect it early and get down to the root of the problem has been, I think, my saving grace, What are your thoughts, Dr. Jade?
Well, I think, as a life coach, I'm always asking questions, right? So when your hot takes is, we'll just have to live with the consequences of society, I think my question would be, what sort of consequences would you be prepared to live with as a society? So Min Ong says, I refuse to do so, right? and rightly so. So what if I were to say to you that you could choose the consequences that you want to live with as a society? And what if I were to tell you that going to the emergency medicine, team was not the only answer? What if I were to tell you that you could make some changes on your own without the help of a doctor, without only taking medication, lifestyle changes, for example. And I heard you when you mentioned that, you're looking a little bit at your diet, and also I know you do a bit of exercise, and those are lifestyle changes. It's just, are you willing to do them, right? How can you incorporate it into your life? And a lot of us say we don't have time, right? We don't have time because we're parents, because we're professionals, but is it worth your time?
Right.
So what if I were to say to you that just by taking a little bit of time in your week to look at improving your lifestyle choices, it would make a big difference to you as a person, and it would make a big difference as a community, right, for the whole system. So if I were to say that, would you want to make those changes, right? So I think it's reimagining what the future could look like, but then being accountable for it too.
Except someone like Hossan, in the world of primary care, is a model pupil, right? You're doing something about it. I think you're serious about it. And there are many like you, but there are also equal number of people who refuse to do anything. Last night, just at the dinner, met with someone who was a heavy drinker. I was just telling him it's not good for you. He's almost 60, I think. And his reply is, but life is short, I have to enjoy life. No, you can't get the message through him.
I see.
So you get a lot of this kind of comments. People just not want to get the message. I do not believe they don't understand. But they don't want to do anything.
It's the choice that they've made already in their minds and their hearts, I guess. Like, for Yinzhou, for example, when you go to see, the seniors and all that, a lot of, I'm sure you hear the, 这么老了, no point lah, what for, right? So how do you deal with all that?
Yeah, so I think the silver tsunami, for me, the imagery that is portrayed with that caption is one where there's a wave of seniors who are coming down. But I think for the individual and for the citizen, I think what that means is we will have a senior that if we're a young person like me, will be a caregiver to, maybe one or both sets of parents actually. And I think one part of that is the people that you meet with resistance, with a lot of the excuses or ways of rationalizing their negative examples of health behaviors. These would actually be our family members. And for me, what I believe in is it really starts at home. It starts with the caregivers of these seniors. It starts with the people who are closest to them. And I think the mandate is not just to take care of seniors in this sense or to educate them, but also to provide the resources for the caregivers and their family members as well to be able to take care of the seniors in their households. And if the silver tsunami is redistributed, to the responsibility to everyone, the citizens included, if we all look out for those around us who are seniors, our family members, our close friends, even the workplace, the auntie, the cleaner that cleans the office. I always chat with the auntie and she's always telling me about her health problems, but she's saying like putting off the medical appointments, putting off taking medication. So it's really that journey, and that involves rapport, relationship building. And I think that's really a big part of what citizens like us can do.
Yes.
I'd like to affirm something that Yinzhou and Min Ong had just said, which is that sometimes you might meet with grumpy old bears who aren't ready or willing to change. And it's really difficult to change their minds, but that's okay. The wonderful thing about what we're trying to do is that you don't have to wait for the perfect circumstances to get started. You don't have to wait for every single person to be on board before we say, let's make a change as a society. So we can still change systems, we can still get involved, we can still get started, even if not every single person's on board. And who knows, maybe they will get on board.
So we're talking here about this on ground up level. From the government's point of view, and are there processes being put in place to kind of meet us in the middle somewhere?
I would say, as you put it, it's a ground up effort. First, what Dr. Jade say, you can't get everyone started. Whoever is ready, get them started. And how do they get started? As Yinzhou say, often it's about personal relationship. After a while, they trust you. They know that you care. And since somebody who cares for me asked me to do something about it, I'm more likely to listen. Essentially, it's a ground-up effort. And so therefore, when you say what can government do, I think government can do by supporting the ground. Give them the resources, the support, the rules, the regulations, and then they can do their job properly.
Well, that brings us to our next hot take. As we grow older, we inevitably become frailer and we will end up in nursing homes. Is that our future? Nursing homes, for at least for younger citizens, they can live their own lives. But as we grow older and, sometimes we are singles, sometimes we don't have children to look after us, will we all end up in nursing homes? Are there enough nursing homes in Singapore? Are we ramping that up, Minister?
We're doubling the number.
We're doubling.
From now to 2030. And when I came to MOH and I asked that same question you just did and I got the answer, that got me worried. I know we need more nursing homes and we will build more because there are families who are working and then you have to take care of seniors. They really can't cope. Nursing homes are there to help them. But if our solution to aging is more nursing home, I think it's not sustainable. We are doomed to fail. Yeah, it's just like saying when we get older, therefore we need more hospitals and more emergency care and more chronic care. I think we're doomed to fail. At some point, we have to say, let's do the more longer term, let's address it longer term. And there has to be preventative care through primary care. So likewise for aging, nursing home is not the ultimate solution. The solution is how do you age with agency, in the community, in your own home, but with activities and support around you. And that's the best way for seniors to remain healthy. For those who are already frail, who families can't take care of them, I think we need to provide nursing homes. But for those who are still in their 70s and still active, still healthy, let's keep it that way. Why not keep it that way? Yeah, it's possible to keep it that way. So invest in that area instead.
But then you see sometimes, at home, the caregiver, for example, it could be the family member, it could be the domestic helper at home, not equipped to take care of, the elderly who, Yinzhou, maybe you had come into, meet people like this. What are your thoughts on that?
Yeah, so I spent 2 months working in a nursing home a couple of years ago. And I think for me, that really opened my eyes to the idea of quality of life and living. What does it mean to have a life well lived? Which really came down to the question of would you have seen yourself in a nursing home in this state of health as well as state of life? I wouldn't wish to be in a nursing home as well myself when I age, or as much as possible delay needing to be sent to a nursing home with the professionalized level of care for the high needs that the seniors have. And I think on ground in the community as well, similarly, people may be feeling that way. But ultimately, as you mentioned, it is still the context of the caregivers in which they have to eventually decide to send them to the nursing home. So I think a big part of that conversation involves how do we delay frailty enough not to require to be sent to a nursing home. And on the other side, from the government standpoint, is also then to equip and provide the resources for assisted living or living in place, aging in community. But as an interim, how do you encourage seniors to find their place in community, find their tribe, find the activities and routines that they're able to do with the access that's provided in specially designed community care apartments, with also the specialized resources of medical care that are cited within. So that's really what I'm looking forward to in the Healthier SG as well, the infrastructural and policy developmental change that will really assist someone to have more options when you think of care.
So how far are we down the line with that? Setting all this up right now, Minister?
For someone who are senior, your biggest enemy is loneliness. Loneliness will drive your health to deteriorate in a very fast pace. And therefore, we must build the social infrastructure to help them stay active and to have friends, to have love, to have relationship, to have friendships. And actually, when I move around Europe and look at their models, they try their best to do it. But actually, their communities are not built to do it. I just visited Manchester because they have a good program there. But when I look at their residential areas, well, not easy. When I look at ours, hey, we have built it right. Maybe for a different purpose. But today you can see every HDB precinct, there is void deck, there is playground, there are coffee shops, there's somewhere there will be a hawker center and there will be a park. All these are precious common areas that we can
hang
activate.
out. Yeah.
We can activate and encourage active aging. Yeah, which is why for the active aging centers, outreach becomes so important.
Right.
I think especially after COVID, there are many seniors who say, "Oh, don't dare to go out, outside got COVID. Last time Minister for Health say, don't go out." But COVID crisis is over.
Yeah.
It's time to get out, make friends, because that will keep you healthy.
So I'd like to add something, which is when we say that we become frailer and we end up in nursing homes, there seems to be a little bit of stigma around nursing homes. And I wonder if it could be different if we could remove that stigma, such that nursing homes were not just utilitarian dumping grounds, but rather somewhere you go to if you have to, if you want to, if it suits your needs. And nursing homes can also be, if you look at the public hospitals, for example, they're beautiful now. There's a beautiful pond at KK Hospital. There are so many trees in Kutik Puat. The up and coming Woodlands Health also has got so many rehab gardens. It's a beautiful place. And so nursing homes perhaps could also be, built, and I'm sure that they will be, to be more than just utilitarian.
Not too bad.
So it's if you have to go there, if you choose to go there, it's a good choice. However, we have other choices as well. For example, to age in place at home. And to do that, we equip them, we educate our caregivers so that they can do what they have to do if someone at home becomes frail, and until the point when they have to go to a nursing home, then it's still a good option. I think there can be a lot to be done to remove many stigmas in aging. And I'm sure that we can do that.
So I just want to say that when I was traveling in Australia, in Sydney, I noticed a lot of communities that have been built for 55 years and above. It's quite interesting. They're not elderly, they're our generation. And in this community, you buy a house and you've got healthcare available, a supermarket, and it's very interesting. I thought, it's not elderly care. It's not, it's a community, I think, and it's quite interesting to think about as well.
They have a system of more like retirement villages, not
But
different from nursing homes.
Right,
Yeah,
I
so
see.
it's a community.
Yeah.
So you live there, and I think it's quite wise to choose 55 and above because not everyone is old.
Yeah,
You've
exactly.
been living with people like us, 2 years we qualify.
But I cannot
Yeah.
I cannot retire.
Yeah, so you get a community and people looking after each other. I suppose they also have the land.
They
to
have
do
the
it.
land,
Yeah.
exactly.
So in Singapore, we try to do some of this. We call it the community care apartments. HDB is doing that. There are 2 pilot projects. And then we have a private operated one that has just been tendered out at Perry Avenue. So we can have some of that. And we also have the Kampong Admiralty kind of concept where it's also more kampong-like, where there's a community. But I think that's not enough. There's from nursing homes to living in your own homes, and in between you got CCAs and community care apartments and others. We need a whole range to cater to different kinds of seniors.
I think we need to also have a look at how we look at being older and getting older. So I think it's a shift in mindset, and maybe Dr. Jade can tell us a bit about how do we shift this mindset as a coach? How do you approach someone?
Well, first of all, I feel that aging is a process. You can put a hard number for administrative reasons when someone is considered elderly, but it's really just part of our lives. And so we're constantly growing, we're constantly evolving. I think it would be foolish to think that, we reach our peak at only a certain time, and after that, it's all downhill from there, So I feel that it's much healthier for everybody just to acknowledge, that this is a part of our lives. It's part of a transition that we all go through. And so when we say, what is the government doing about the aging population, for example? I mean, it's not just the aging population, it's the whole population, right? We're all invested. It's not just one moment you're young and the next moment you're old. And then there's what sorts of things are there? So hopefully that answers your question. along the way also, there's so many things that are really helpful. For example, many people are very worried about dementia when you become old. But did you know that just by exposing yourself to more green, that can actually retard the progression of dementia? There have been so many studies that have been conducted that show that just being amongst the green, and there's so much green all over in Singapore, can help to retard the progression of dementia. Doing more group activities, hanging out with friends, doing activities like choral singing, gardening. Like these are all really, really helpful. And these are not things you suddenly take up when you're like 78 years old. These are things you can do as a family from before. So I feel like if we look at this as part of our lives, rather than just something that happens at one particular point and then all the ammunition has to come out for that target population, then I think we'll probably be more successful as a cohort.
Not to forget, there's also high correlation between diabetes and dementia.
Yes, that's right. That's right.
So therefore, you control your blood sugar, eat a better diet, exercise, you actually can do something about your chances of getting dementia.
Yes. So we're looking forward to aging well. We're looking forward to doing this together. It's not something that we dread. It's not forever trying to celebrate your 18th birthday, It's just, this is life.
28.
Of course.
Well, that brings us to our next hot take. If the government does more for our senior population, solve our problems. Does that work?
I think government doing more, the state doing more is necessary but insufficient. Yeah. In the end, you look at COVID. When I walk on the streets today, many people do come out to me and say, government did well to help us address COVID. I say, no, government did only one part. Our policy was right, to try to vaccinate everyone. But everyone did your part to get the vaccination, or enough, 9 out of 10 Singaporeans did that, or whoever lived in Singapore did that. Without that level of participation, we'll suffer a lot more for COVID. We'll probably still be out of it by now, but with a much higher rate of infection as well as mortality. So in the end, it's always about government, people, social sector, all working together. I think government doing its part to support the ground more, and then the ground doing its part to execute the plans and doing your outreach, persuading people, getting people to form social circles, and then individual knowing that they have the agency to do something about it and exercising that agency. Then I think we can do something about the problem.
Because I think the government has already put in place like Healthier SG, for example, and we've got Active SG, the gyms everywhere in Singapore that you only pay $3 to go in and work out if you want to. Is there anything more that the government is doing on top of all this?
Those in the AACs are free. You don't have to.
Okay.
Yeah, you do weights in the AACs, and it's very popular among some seniors. That one is actually free. You don't have to pay $3. I think for me, AAC is a fantastic social infrastructure. We are expanding it.
Okay.
Expanding it faster than we expand nursing homes. Yeah,
good.
Ought to. But I think what is lacking is the outreach, as Yinzhou mentioned.
Yeah.
Because you can fill up your AACs. And we do fill up our AACs with all kinds of activities. But every day you see the same people coming, right? At some point you have to you have to acknowledge for everyone that come and use our services and listen to our advice, 5 more or 9 more is upstairs in their own room saying that, beside Chukia, cannot go out.
What do you think is that problem? Why aren't they? They know about it, right? Obviously.
They are lonely.
And they don't want to come down?
And when you're lonely, you like to stay alone. So you do need people to knock on the doors, make friends, and over time, they feel that this person cares for me and he's asking me, please go downstairs. And we have activities. We have free meals. We have cooking, communal dining together. We can all go to the market and buy food, and then we cook together. And when you can have that kind of communal, that social circle to do something together, we have a good chance to bring them out of their homes. And we have a few AACs that are actually quite successful in doing that. So now question is, how can we make this, just like coffee shops, which is all over Singapore, can we make such AACs ubiquitous all over Singapore? And that's a social infrastructure. So you ask me what government will do about it. I think beyond Healthier SG, we need a specific program for the aged. Yeah.
And how difficult is it, Yinzhou? Because you knock on doors, right? And what is your magic spell that you can get them out of the house? What do you say? What do you do?
There's a big part of the government involvement in the social planning and the mandate for spaces and infrastructures, including having social nodes in community where it's places where people can convene, whether it's a coffee shop, it's a hawker center, it's a library, or even a space like a void deck or a pavilion or table tennis table. All these are planned for by the government. So I think what needs to come in from the ground would be the programming aspect. And I think that's what we do on a day-to-day basis, thinking about the population of seniors that we serve, what programs would they be interested to come in. And the role of AACs as well as staff at AACs is really to think out of the box beyond just preaching to the choir. As Min said, right, if the same people are coming for the programs all the time, you're going to be engaging, hitting engagement numbers. But in reality, the people who actually need the services and engagement will still be at home.
Yeah.
I think one part of the population we do see who have a life of their own. So they have grandchildren, they go there every week to take care of them. They have friends, they travel, and they are really meaningfully engaged personally. And we encourage them to continue to do so and have this maintenance of social behaviors. But it is really the fraction that would not be engaged at all or prefer to keep to themselves. So one part that we see is the part on identity. I think for Singaporeans being in Singapore where you work in the same company for many of the seniors for decades, and then the point of retirement, and the next day suddenly you don't have to report to work. The routine that you've been taking for the past 20, 30 years, it is a big contrast. It's kind of like, for some of them, they describe it as, it's like jumping off a cliff without a parachute. The sensation of free falling into oblivion. I don't know what I'm going to do when I retire, but I have to retire anyway. And I think that's the big part of what we do when we door knock. What do you like to do?
Okay.
If you organize this, will you come down? And I think the other part is about trust building, and that takes a lot of time and social capital.
Can I ask, what activities in your experience is the most popular among seniors?
In post-COVID, I think a lot of outings and events are coming back. I think one common factor is the ability to experience new things. New experiences is always fun. For example, recently we brought seniors to try the Republic Poly's high elements course. Our oldest senior was 81 years old, and he said, like, at this age, nobody would allow me to go up the rope on the high elements, but thanks to you, you gave me the opportunity, and he was willing to do it, even though it's something he had never got the opportunity to try before. We have an issue also with male rates of participations, right? In senior activity centers, most of participants would be females, and we see that correlating the identity factor of work as well.
Yeah, I think I agree with you because, when my dad retired at 55 back then, and then suddenly you realize you've got a long time of nothing to do when you retire at 55, back in the day, until now he's 80. So it was good that he had, a childcare center. We started a before after school care center, active for children and stuff like that. But, Jade, can I ask you then, how would you change the mindset of someone who goes, nah, done already, done with life, 55, retire, nothing to do. But then you live longer. You live to be like 80 something, right? So between that, it's 30 years of nothingness. But how do you encourage people like that?
Well, maybe we could ask them what their best hope for their future would be. What would they like to see instead, right? And you might be surprised because we always ask the government to solve our problems by putting up more trees and building more centers and stuff like that. But what actually is the problem? If the problem is isolation, loneliness, you can build those centers and you can put up all those trees. You can even have formal programs for them. But who's going to make them go? Or who's going to accompany them? It might be their family, their caregivers. They might have to decide they want to do this themselves. So asking them to imagine what their best hope for their future might be could be a good way to get started. I think sometimes we focus a lot on fear. If you don't do this, that's going to happen. And that can be a little discouraging.
Yes, for sure, right? Yeah. So Min Ong, in looking down, if you had a crystal ball, right, and you're looking into the future of Singapore, is there hope for this aging population? Do we have something to look forward to in terms of a community, in terms of being able to to live comfortably into our old age.
There is always hope. What is inevitable is aging. You can't discard your health, be very sick, and expect the hospital to repair you. It's
Yeah.
never the same. Even a car, after repair, is never the same.
Right.
And the body is even more complex, and it will never be the same. So do preventive care from a very young age. So back to your question, is it a hopeful future? I think it can be.
Can be.
It certainly can be. This is like dealing with COVID, but spread out over 20 years. Right? Whereas we have to
Yeah.
deal with COVID in a short 2-3 years. But the steps are fairly similar.
I think it's also recognizing, Min Ong, that as you say, that it's going to be over sometime. We have, we have a lot to look forward to. It's also recognizing that good health isn't just being disease-free, So that helps them to take stock of what their imagination of their good health might look like. That it's not just being disease-free. There's also social health. I've mentioned how to get over loneliness and isolation, for example. But it might be something else that's bothering them. The person who has stopped working and now has years yawning ahead of them. Maybe it's financial health that's bothering them, but they don't want to say it. Maybe there's something else that is missing in their lives. So I think encouraging the elderly to talk also about what's bothering them could be helpful, because all these are different pillars of health too.
You do wellness, but to a lot of people, when they think about wellness, it means going to a resort, do meditation, attend yoga classes, all cost a lot of money. Does wellness need to be expensive?
It does not have to be expensive, and it doesn't have to be something special you only do once every 10 years. So you're absolutely right. I think when people found out that I was a wellness coach, they thought that this was something that have to, save for 30 years to go to a fancy spa in Austria to be able to achieve that peak of wellness. But in fact, I believe that wellness can be in your everyday. It should be practical mindfulness that we're practicing. And it can be simple gestures. It can be getting enough rest, getting good sleep, maintaining good relationships with your family. This is part of wellness as well. It could be small steps to be able to make your future better. So it doesn't have to be huge and expensive and frightening. It can just start with a small step that you're ready to take. As long as you're ready and willing, we can coach you towards it.
In fact, cut down smoking, cut down alcohol, take less sugar, you save money.
Indeed, absolutely.
Yeah, I spent all my money on essential oils. That was wonderful to be able to share all this with us, but it's time to come to the end of the episode. Thank you so much, my guests, Min Ong, Dr. Jade Kwa, and Yinzhou, for sharing and also bringing us on this journey of what aging in Singapore could look like. Well, this is the final episode of Red Dot Hot Takes, and it's been wonderful sharing with all our ministers and our guests about the 6 pillars of the ForwardSG exercise. If you have any comments or questions, please click on the link and we will do our best to get back to you. In the meantime, I'm Hossan Leong. Take care and keep well.